Dr. Schneider and Allison here at Riverview Face and Body Aesthetics, and we wanted to walk someone through how do I get my breast implant into the correct location. Well, the two approaches that we use here at the office are through the armpit, or what we call the transaxillary approach. Some people will call that a scarless breast augmentation. It's a little bit of a misnomer because there's got to be some scar. It just depends on where the location of the scar is. But we can hide it in the armpit, where we then make a tunnel down underneath the pectoralis muscle where the implant goes. And basically that's going to be a scarless transaxillary augmentation. Now, some people, especially those that need a breast lift, will have to have a direct approach of the incision underneath the breast in that natural crease. Basically, as that is done, the incision is going to be underneath this area, and then when we do the lift, it's going to be pulling that skin to elevate the nipple position up into its more normal, youthful, perky position that it was probably in their 20s or early 30s. But as time goes by, aging occurs, the nipple position goes south, and we're here to help people with that. Some need an augmentation at the same time, and others just need a breast lift. Allison's going to demonstrate with a silicone implant what that kind of would look like, whether a transaxillary is done for the augmentation or a direct with a lift where the incision goes underneath the breast.
So when you come in, it's going to be important to determine first, do you need a lift or do you not need a lift? Because that's going to give us the answer of your options of the augmentation. If you need a lift, when we lift that skin up, using this as the example, you're going to see that there already is some of your own breast tissue there. So we want to keep in mind that when we put an implant on the top of your current breast tissue, that's going to make the size bigger than what the actual implant size is that we're putting in. So that's why it's really important to come in for the consultation so you can play around with different sizes so we can see what's going to be the best for you, and it's going to be the most natural based on what your current breast tissue looks like right now.
Absolutely, because we all know that the implant goes under the muscle. Some people have had implants where they put it on top of the muscle, where it's just underneath the mammary gland and the fat. But the best types of implant to give people the largest projection but also don't see the implant would be putting it under the muscle. So that's what we do here at Riverview Face and Body Aesthetics. Give us a call at 651-493-8501 or visit us on our website, www.riverviewfacialplastic.com. Just remember, we're more than facial plastics.